Hello everyone, welcome to our channel Canadian Nurse Expert. In this video we're tackling a crucial topic on the NCLEX-RN elimination. Think of this as your personal boot camp for all things bladder, kidneys, and keeping your patients comfortable. We'll dive into 10 challenging questions, covering everything from urinary retention to renal calculi. So grab your thinking caps, your lucky pen, and let's conquer this quiz together. First scenario, you're caring for a patient with urinary retention, meaning they're having trouble emptying their bladder completely. Which of these findings would you expect to see? Your options are A. Increased urine output, B. Frequent small voiding, C. Dark brown urine, D. Continuous incontinence. Take a moment, visualize the scenario, and choose your answer. Did you go with B. Frequent small voiding? If so, you're spot on. Frequent small voiding, also known as overflow incontinence, is a classic sign of urinary retention. Urinary retention leads to overflow incontinence, where the bladder overfills and releases small amounts of urine, frequently due to incomplete emptying. Next up, let's talk about renal calculi, those pesky kidney stones. Imagine your patient is doubled over in agony with severe flank pain and nausea. What's your top priority? A. Encourage oral fluids. B. Administer prescribed analgesics. C. Obtain a urine specimen. D. Teach the client about dietary modifications. The answer is B. Managing that intense pain with analgesics is crucial. Pain relief is the priority as kidney stone pain, also known as renal colic, is severe. Other interventions follow after pain management. Time for some numbers. You're monitoring your adult patient's urine output, a vital sign we can't ignore. Which of these measurements should send up a red flag, prompting you to call the healthcare provider immediately? Is it A. 800 milliliters in 24 hours, B. 50 milliliters in 2 hours, C. 1200 milliliters in 24 hours, D. 250 milliliters in 4 hours? In this case, B should ring alarm bells. 50 milliliters in 2 hours is significantly below the normal range, and we need to investigate further. Oliguria is defined as urine output less than 30 ml per hour. This could indicate kidney dysfunction and must be reported. Let's talk diet. You're educating a patient with chronic kidney disease about managing their potassium intake. Which of these tasty treats should they limit? A. Apples, B. Bananas, C. White bread, D. Chicken breast. The correct answer is B. Bananas are surprisingly high in potassium, which should be limited in CKD patients to prevent hyperkalemia, a condition that can lead to heart complications. Imagine you're teaching a patient with stress incontinence about bladder training. Which statement by the client indicates a need for further teaching? Options are A. I will avoid caffeine and alcohol. B. I will perform Kegel exercises daily. C. I will limit fluid intake to reduce incontinence episodes. D. I will try to urinate every 2 to 3 hours, even if I don't feel the urge. The correct answer is C. I will limit fluid intake to reduce incontinence episodes. Limiting fluids might seem logical, but it can worsen incontinence by concentrating urine and irritating the bladder. Let's talk about BPH, or benign prostatic hyperplasia, a common condition in men as they age. Your patient complains of difficulty starting his stream and a weak flow. What intervention do you anticipate? A. Encourage increased fluid intake. B. Prepare for urinary catheterization. C. Educate about alpha blocker medications. D. Obtain a stool sample. The most likely intervention here is educating about alpha blockers. Alpha blockers relax the prostate muscles, improving urine flow. Catheterization may be necessary if retention becomes severe. You're assessing an older adult for a possible urinary tract infection, or UTI. Which symptom might throw you off because it's not the typical pain or burning we usually see? Options: A. Dysuria. B. Cloudy urine. C. Confusion. D. Hematuria. The answer is confusion. Older adults often experience delirium or altered mental status as the primary symptom of a UTI. You're giving discharge instructions to a patient who had urinary calculi, those painful kidney stones. Which statement from the patient tells you they need a bit more teaching? A. I will drink at least 3 liters of fluid per day. B. I will decrease my sodium intake. C. I should strain my urine to catch any stones. Or D. I will avoid all dairy products to prevent future stones. The answer is avoiding all dairy products. While diet plays a role in stone prevention, completely cutting out dairy is often unnecessary and might not be the right advice for every patient. That's a wrap. You've officially crushed our elimination quiz. Review the rationales, understand the why behind the answers, and you'll be well on your way to NCLEX success. Keep those brains sharp by taking more practice quizzes and diving deeper into any areas where you felt a little shaky. You've got this, future nurses. Keep up the amazing work, and I'll see you in our next video.